Hi, I'm Dr. David. A stuffy nose, a cough, a fever. You should have had some cold symptoms probably for a while now, like a week or two, by the time you get this sinus headache. Those headaches are treated by treating the sinus infection itself. So how do we do that? Well, we frequently use antibiotics. It's not clear that antibiotics are the end-all and be-all for treating sinus infections. Particularly in adults, it's not clear that they work all that well. However, one thing that does seem to work well is the sort of steroids that you squirt up your nose to treat allergies. Now, those are prescription medications, just like the antibiotics are. You would have to go to your doctor for that, but that does seem to help with adult sinus infections. One thing you can do without seeing a doctor is to get a neti pot. That's this device that looks kind of like a genie's lantern. You put saline in there, salt water, and then you introduce that water up into the nose to clean out the sinus passages, and that may actually alleviate the symptoms of sinusitis. Now, a lot of people think they have sinus headaches when what they're really having are migraines. Your sinus headache shouldn't be episodic. It shouldn't recur every week or two. It shouldn't come on when the weather changes or when your period is about to start or when you have a period of stress. It shouldn't get better just when you lie down and take a nap. It should not come with visual changes such as flashing lights or blobs or parts of your vision where you can't see. Those symptoms are all quite typical of migraines, as are nausea or vomiting. If you're having that kind of headache, you really should seek a doctor's care and not assume that that's coming from a sinus infection. Now, any headache may get better with the use of an analgesic, such as ibuprofen, that's what's in Motrin, or in Advil. Tylenol may help, acetaminophen, and naproxen, which is an Aleve, or that naproxen is what I'm thinking of. It's an Aleve and naproxen. They may all help, but you don't want to get to where you're using them several times a week, because then you can get rebound headaches where when you stop using them, your headache gets worse. So that's a lot of information, but overall we're talking about treating sinus headaches, and I'm Dr. David Hill.